Afternoon, ma'am. I am Mary Jan Villata Katubig, second year college, section B. So today's video demonstration, I'll be performing oxygen therapy. So oxygen therapy is also known as a supplemental oxygen. It is the use of oxygen as a medical treatment. So let's start. First things first, we need to wash our hands. Then after that, we really need to check the doctor's order. Then after that, it is the time to explain the procedure and hazard to the patient. So good afternoon, ma'am. I am your CNA today. I am American Villata Katubig. So for today, we would be doing oxygen therapy. Okay, ma'am? Okay. So after that, we really need to check the oxygen source setup. Then we have here the humidifier line. Then really need to put it with this distilled water. Then close it. Attach humidifier and flow meter in the oxygen source. As you can see, we have here the flow meter already. Then this we really need to attach this. Then after that, it is the time to apply this oxygen tubing and nasal cannula to the humidifier. Then turn on prescribed specific flow rate. So in this case, we need to turn it from 1 to 5 liters per minute. Then after that, we really need to check for bubbling in the humidifier. Then after that, we need to position our patient in a semi or high polar position. Then it is the time to attach this nasal prongs to the patient's nostrils. Then secure this cannula to over the patient's ear. Then after that, position the oxygen delivery equipment appropriately. Then it is very important to put a no smoking sign on the patient's door in view of the patient's visitor. Then after that, it is very important to check the flow rate every 4 hours. Then assist your patient's nostrils every 8 hours. Then after that, we really need to document the oxygen administration method, the time the therapy began, and the flow rate. Then it is very important to take note the response of the patient in the therapy, and as well as the changes of the condition. So let's proceed to the nasal prongs oxygen. In this case, we need this oxygen adapter attached here in the flow meter. Then after that, we need to attach this oxygen tubing. Then place this nasal prongs to the patient's nostrils. So that's for nasal prongs. Then next is we go to the face mask. In this case, we also need this connector piece of this face mask. As you can see here, I just use this as an alternative. Then attach this oxygen tubing. Then it is the time to attach this axial prongs to the flow meter. Then on for the prescribed flow rate. Then attach this face mask to the patient's face. Then this strap under the patient's head. Make sure to slightly pinch the nose to secure a good sealed of face mask. Then after that, let's proceed to the rebreathe. So for the rebreathe, we don't need the valve, and we really need to get this connector piece because we don't need this anymore. Then attach this without valve. Then it is the time to attach this oxygen tubing here. Then turn on the flow rate and prescribed rate. In this case, we need 8 to 16 liters per minute. Then it is the time to attach this into the patient's face. Then you must secure this over the patient's ear. Then as I said earlier, we need to slightly pinch the nose to secure a good seal. Then let's proceed to the non-rebreathe mask. The non-rebreathe mask and rebreathe mask is there are just some difference. The only difference is we need to put this valve in here because it is a one-way valve. The person can suck a oxygen out of a reservoir, but they can never breathe back to the bag. Then after that, we also need to put this valve here in the side only. Then attach this non-rebreathe bag to the face mask. Then attach this oxygen tubing in this side. Then turn on the prescribed flow rate. Then it is the time to attach this on the patient's face. Again, secure this in the patient over the patient's ear. Then slightly pinch this nose to secure a good seal. Then just position this in a comfortable position. Then it is the time to get this. Then, that would be all for the oxygen therapy. Thank you for watching.